So as an introduction for me, I work at CMHA Ontario. I am our governance lead, so working with our board of directors and also working with our branch boards and support. And I mentioned to the speakers earlier, we within the mental health, within the community mental health space, there's also great interest and learning and practices and involving and engaging people with lived experience in mental health within our decision-making processes. All right, so now that we are just up to 2:30, we're going to have a little 10 seconds of quiet stillness to allow our editors to edit effectively. And then I'll start with my pitch and pass it on to our speakers. Okay, welcome to the concurrent session D4, Developing a Prison Health Research Council of People with Lived Experience of Incarceration. My name is Ken. I'm joined by my colleague Irina, and we'll be your facilitators for this session. Before we get started, there's a few housekeeping notes. First, please note the Zoom toolbar at the bottom of your screen. Throughout the presentation, you can use the Q&A feature to submit questions. We can review those questions and answer them at the end of the presentation. During the presentation, please ensure your microphone is on mute. This session will be recorded as are the other sessions throughout the conference and will be available to you for 90 days following the conference. I'd also like to remind everyone that we do have a closed captioning ability within this session. So you may see a CC icon on the bottom of that toolbar, or you may need to click the More button, so a circle with 3 horizontal dots, to access that CC feature. You may also need to click that to access the Q&A feature. I would also like to respectfully ask all of those attending today's session to engage with each other thoughtfully and always consider the impact of your words and interactions on others. As facilitators, we will not tolerate any abusive or inappropriate behavior or hate speech, and will ensure that anyone who engages in such behavior is removed from this session. If you have been disturbed or affected by such an event, please do what you need to do. Take a break, step outside, practice deep breathing, and/or reach out to someone you trust. If you are in a crisis and require immediate support, please check on the FAQ icon on the conference homepage to access contact information for Connex Ontario. With that in mind, I would now like to introduce our presenters for this session, members of the Prison Health Research Council, Brian Pascoe and Tina Eldridge. So with that, take it away.
Thank you very much, Ken. Hi, everybody. My name is Tina Eldridge. Pronouns are she and her. I am a member of the Prison Health Research Council. I'm currently located in Toronto. I am a social worker. I wear a couple different hats. I am the current executive director of a very small grassroots organization called Written House. I'm a member of the Walls to Bridges Ontario Community Collective, and I also have a small private therapy practice as well as working as a member of the Prison Health Research Council. My lived experience includes that of incarceration. I was incarcerated for about 6.5 years, both at Vanier Center for Women and Grand Valley Institute for Women. And I was released in 2013, and here I am. So became a social worker after my incarceration. And I just want to pass it over to my colleague Brian to introduce himself before we get started.
Hi, everybody. Thanks, Tina. My name's Brian Pascoe. I had a 30 plus year existence in criminal activity, which ended up in many different jails, provincial and federal. For the last 5 years, I have been a peer support worker. I also do harm reduction outreach for a local health unit. I am a person with lived experience. On the Prison Health Research Council, I also am a board member for Northern Recovery Center in Kirkland Lake. I currently live in North Bay, and I'm just doing everything I can to try to help people that are vulnerable and can't help themselves. So from there, we will pass it back on to Tina, who can start our presentation. Thanks.
Perfect. Sounds great. Thanks, Brian. Sorry, just give me one moment, folks. I've got to minimize my screen here. I'm sharing screen. Can everyone see my screen?
Yeah,
Yes.
yeah, the slides have moved. You're ready to go.
Okay, perfect. I'm sharing screen, so if any questions come up, I won't be able to see them. So our initial vision for the Prison Health Research Council was to move prison health research in the Department of Family Medicine at McMaster University along the IAP2 stakeholder engagement options framework, from primarily research activities that primarily inform and consult current state towards a spectrum of research activities that also involve stakeholders, collaborate with stakeholders, and support stakeholder-led research. You can see this chart here talks about the different ways in which we inform. So researchers provide stakeholders with balanced and objective information to assist them in understanding the research. We then move into consult. Researchers obtain stakeholder feedback on the research. And moving to involve. Researchers work directly with stakeholders to ensure stakeholder concerns and aspirations are consistently understood and considered in the research. Then we move into the collaborate phase. Researchers partner with stakeholders for salient aspects of the research. And finally, moving into empowerment. Researchers assist stakeholders in conducting their own research. So this is basically the spectrum that we have moved through in our work as a council, and we'll talk a little bit about more of that in our slides. So sorry. Project development initiation. Faculty researchers and research staff in an academic department of family medicine, including a community investigator with lived experience of incarceration, Lindsay Jennings, who I believe is in our audience today. And we developed an initial conceptualization of what a prison health research council might look like and do. We applied for and successfully accessed seed funding from our affiliated family medicine associates. We began meeting, I believe, in January of 2024. Some of the objectives of our initial grant application was to establish a research engagement council of people with lived experience, referred to as PWLE, of incarceration in Ontario to shape research on the health of people who experience incarceration across the province. And number two, to evaluate the feasibility and value of research engagement council to people with lived experience and the Department of Family Medicine. Our project goal was to establish a research council of people who have or had experienced incarceration, including from populations that are overrepresented in prison, creating a space where council members could drive the direction of the council and prison health research overall. And why? Why did we want to create a prison health research council? Lived experience is a pillar to truth. Lived experience represents expertise, and people with lived experience of incarceration bring critical perspectives on health, healthcare, and incarceration experiences. People who experience incarceration are often included in research as participants. We're studied a lot, but are often not included in the leading, collaborating, and planning research. So that was the IAP2 framework that I showed you, including people who the research is about can make the work more appropriate, valid, and ethical. The experience, credibility, and expertise of people with lived experience may not be recognized. We are a disenfranchised population. Research tends to mainly focus around federal prisons as information is more readily available. However, provincial jails in Ontario need research to be done to show how the health care of those incarcerated is horrendous and harmful and counterproductive to the idea that jail is for rehabilitation. And research geared towards crime, recidivism, and not how incarceration affects someone, and also how healthcare is distributed within correctional institutions and barriers to accessing healthcare. Project development, engagement, and recruitment. We worked with a community engagement consultant Amplify engagement to develop a recruitment and engagement strategy with an explicit focus on diversity of socio-demographic characteristics and perspectives. We shared info through personal and professional networks and social media, and we held 2 virtual information sessions. 44 people applied. Out of those 44, we selected 14 people, including people who are Black, Indigenous, queer, trans, and Two-Spirit, recognizing these populations are disproportionately represented in Canadian correctional facilities and or face specific structural barriers to health. And I believe that my colleague Brian takes over from here. Am I right?
Yeah, sure. Yeah, my name's Brian again, and that was kind of how we formed the council. The council itself consists of 10 members: Kenora, Latasha, George, Sonia, Marcy, Matt, Mike, Fallon, Tina, James, Honey, and myself. We also have a project team, Dr. Claire Bodkin, who is the co-primary investigator, Dr. Fiona Tuyumajin, who is the co-primary investigator, Lindsay Jennings, who is the community investigator, and Jessica Garber, who is our research coordinator. Okay. So our work to date, administering the council, we've been holding 2 virtual hourly meetings since January 2024. Our meetings routinely include council members and the project team of faculty, researchers, and research staff, and may also include project guests. We also pay honoraria for council members consistent with best practices for patient and public engagement. So we get paid for this, and we get to tell people what we think will work to help people incarcerated. Our key themes across meetings are collaboration and community building. Regular efforts were made to strengthen relationships among council members, ensuring effective collaboration and a supportive environment. We also do research and advocacy. The council consistently focused on integrating lived experience into research, identifying gaps in prison healthcare, and there's lots, and advocating for policy changes. Feasibility and funding discussions often included assessing the feasibility of proposed projects and securing funding to sustain the council's work. And we've also had a lot of great guest speakers. So guest speaker engagement, they provide insight into various prison-related issues, which inform the council's ongoing discussions and plannings. Our work to date, we've been learning about contributing to existing research. Some council members had experience with research when they started. Some, like myself, did not have a lot. So they started the stages of research and how to access research funding. So we did like a Research 101 workshop. We've also discussed prison health research projects at various stages of development and implementation, led by researchers in the McMaster Department of Family Medicine and other Canadian researchers. On council members engaged in discussions with researchers and provided input based on their experience and expertise. So we've also, through a structured exercise, we began to explore priority areas for research and for our council, which we framed as small wins and big dreams. There's a lot of change that needs to happen, but we will take the small wins as they happen. So recognizing both challenges for the potential of our council to make major contributions. We collaborated on the development of many applications for funding to the Canadian Institute of Health Researchers that were led by the researchers and were responsive to council discussions. So we've had a few successful grants already. One, we've had the CIHR Planning and Dissemination Grant. So that project is involving people who are incarcerated and guidelines. It's the RESPECT guidelines. We've also had McMaster University Academic Family Medicine Associates Grant, which is for mortality in people who experience incarceration in Canada. A lot of those statistics go unnoticed, and that's not cool. Also, we've done a CIHR Planning and Dissemination Grant, launching a research council of people who experience incarceration to advance collaborative research on prison health, which is like our overall goal. We are waiting on decisions for grants for heat-related deaths, and also a grant for a CIHR Catalyst grant. But we hope to be successful with those. Our impact to date. So the council to date has contributed work or perspectives to projects on topics such as mortality from opioid toxicity, shifts in drug enforcement and impacts on people who use drugs, life sentences and lifers, climate justice in prison, healthcare standards in Canadian prisons, reporting guidelines for prison health research, and consultation on legal claims for individuals in federal custody with mental health concerns in collaboration with the prisoner legal services. And this is just scratching the surface. There's a lot of change that needs to happen in our prison systems, in my opinion. So for the council members, we are providing people with criminal records with part-time paid roles, which is like amazing. It's very hard to get work once you come out of jail, and this helps. We're introducing new skills, building on existing skills, and building resume experience. We're giving people whom the research is about space and opportunity to lead the research, give their perspectives on existing research, and collaborate with other researchers across the country, which is also pretty amazing. Next, we're going to be setting up a webinar to present a work to date, what we've done to date. We're seeking funding for ongoing council sustainabilities, and we absolutely welcome any ideas or contributions regarding that. We're also working collaboratively to develop new research that the council and researchers can co-lead. So we've spent 2 full council meetings going through the process of identifying a topic of interest, developing a research question, and identifying methods. And we came up with a lot of different things there. And from those, we will continue working towards grant preparation. So this is getting to the end of the presentation, which I guess is good. We had an hour. You guys might be able to leave early. So our conclusions: the council works towards ameliorating the systematic exclusion of people with lived experience in incarceration from research through reflecting the needs, priorities, and issues of people who experience incarceration. So our experiences are very valuable because it is a view into incarceration that we don't often see, and we can start treating these people better and possibly getting them on a path to a better life. This work holds relevance to researchers in other jurisdictions who want to bring a voice, power, and opportunities to the people whom their research is about. Exactly what I just said, basically. And you can find us on our new website, which is prisonhealth.ca. We've got this great logo that we all voted on, and I think it's beautiful. And that would be it. That's our presentation. So do we have any questions? Thank you.
Brian, did we want to talk a little bit about our reflections of being on a prison health research council?
Yeah, I could do that a bit.
Okay, then I'll share my feedback.
Okay, so for me, being on a prison health research council is super important. We can help a lot of people that, you know, society just throws away. And there's a lot of good in some of these people. There are some people that maybe they need a little bit more work, but there's a lot of good in a lot of these people, and they have a unique perspective to be able to initiate social change. And I think it's really amazing that we have that opportunity. And I think having that opportunity in more instances would be great too. So that's all I have to say. Thank you.
Thanks, Brian. I guess a little bit about my reflection on being in a prison health council. It's been a really good experience, and the fact that we meet every month has really brought us together and allowed us to connect and get to know each other very well. And we support each other. The whole group supports each other in a lot of other areas unrelated to this prison health council. And for me personally, I think it's support that is key for keeping us as people who are formerly incarcerated free and in the community. Because when we lack support and we lack resources and we lack decent employment, it's very easy to become re-involved in our crime cycles and be reincarcerated. So I think it's also a way to keep us free. It's been an amazing learning experience because for someone even who holds a master's degree, I struggled with research, and I think my research professors just passed me because they were frustrated because I could never understand. I could never pick it up. When it's taught in such an academic way, it's really difficult to learn. So we broke things down and learned like all of the research steps together in a really accessible way so that we all feel like we have like shared knowledge and it's built up our confidence. And the grant applications we have had the opportunity to participate in writing have taught me so much, and it's been such a great learning experience. The guest speakers that we've brought in have given us all connections to the community that are really, really important, and we've learned a lot together. I'm just very, very excited for our work together and to see the future of where this goes. And I'm really proud of us as a council, and we're very happy to be here presenting for folks today. So if there's any questions, we're happy to answer.
I just want to mention that we're just starting to, and this is a large segment of the population that goes missed for mental health and for helping people out. A lot of people write people off once they've been to prison, and that's not fair. There's a lot of good people there that have just maybe made mistakes,
Mhm.
and I think I count myself in those people, or I hope so.
Yeah, yeah. And I think too, it addresses like there's a disparity in healthcare between the provincial system and the federal system. It's very, very different, but both are very lacking. And I think people don't realize like the barriers in accessing decent healthcare that we get inside. It's not like we can go to a walk-in clinic if we're sick. If it's the weekend and you're sick and there's no staff on there, there's no one. And there's just, yeah. Uh, very, very huge barriers in accessing healthcare for incarcerated folks. I'm going to stop sharing my screen so I could see if there are any questions.
Yeah.
Okay.
Thank you so much for sharing your insights and your research, and knowing that this is kind of just the beginning, and hopefully there could just be further research and support. And so, for our conference delegates, you are encouraged, if you'd like, you can take yourself, put yourself on camera. You can raise a digital hand, or you can shout out and ask a question directly to our presenters. I will bring up, there's one question in the chat for Michael, who's curious if any, or what barriers did you face from corrections in forming the council?
Hmm, good question. Brian, do you want to take that question or do you want me to?
I could, but I don't really know if we faced any barriers
Yeah.
forming the council. Honestly, I think like Lindsay and McMaster would know more about that than us. Personally, I haven't. My personal journey, I still get pushback from the police for everything I do, and what I do now is help people get into treatment, and so that's insanely silly. But I understand that my past has maybe created who I am to them. So I'm willing to deal with that and just try to keep moving forward. And eventually people will see that I have good to offer and this prison council has good to offer. And lots of people that maybe have made a mistake have a good to offer. So
Mhm. I would say that really we haven't faced any barriers because all of us are free and in the community now. We have yet to try to do any research requesting health information from prisons and jails yet, and we might face some barriers there, but yeah.
Just a follow-up to that question. Brian, you mentioned that you're scratching the surface on a lot of this work. Where do you see the future of not only the work that you're doing, but how the council has really begun to transform that idea of lived experience being seen as a valuable component to not only you're in custody, but also once out, that you have productive things to share and to be able to be heard and have that information resonate with others. I would just love your thoughts on, what you see as next, or what potential you see from this work.
so the council has really been surprising me a lot. Our thing is big dreams, small wins. And we've been getting a lot of, they're not wins yet, but they're things that could possibly be wins later. I don't know if I should really discuss everything, but I'm hoping that the council can eventually provide like human rights and advocacy to people that are incarcerated that are otherwise not getting it. It's not necessarily the employees. I think it's got a lot to do with the higher ups, and a lot of the employees are just, doing their job. um, so I think we could get a lot more done. We could get people more access to healthcare in prison. We could help people with mental health conditions deal with prison in a different way. I think it would be amazing if we had support set up for when people actually got out of jail so that they could find jobs and things like that. Because if you do your bit and you get out, nobody wants to help you at all. And even if you're a good person trying to do well, it takes a lot of work to fight that barrier. But I think having people that have been there and are associated with educational resources and places can definitely help break down that stigma and those barriers a little bit. And that's it.
For sure. If I can just add to that, I think training us as research and being affiliated with a university gives us some more validity as researchers with lived experience. And I think that process, I would like to see that expand and grow and see us in places like doing ethics review for people doing research on criminalized people. And those are some of my hopes.
Thank you, Tina. That's exactly what I wanted to say.
Well put by both of you. Thank you. I as a just I guess additional comment to that, I think that this also shows hope for when you're out to know that you both are living examples of
Absolutely.
how there are additional skill sets, right? So appreciate that.
hmm
Yeah.
hmm The skills we're developing are really invaluable and we can use them on resumes. And like Brian said, it's a real barrier to accessing employment when you have a criminal record. So all of the skills that we can build just help, ensure that we're more successful.
And creating those barriers so people can't access work and stuff when they're done prison um, doesn't help. Like you're just kind of motivating these people to go back to what they know, and that's going to get them back in jail, and it's going to hurt people in society. So we need to eliminate the stigma, and we need to start giving people chances.
Mhm.
And I think that's important, and that's part of what we're trying to do.
Yeah, yeah. Agreed, Brian. I think there is a lot of stigma around having a criminal record, but what I think a lot of people don't realize is most of us are where we are because they say we made bad choices, but we didn't have any good choice options. We made the best choice we could out of a whole bunch of bad options.
Where that storytelling becomes so key. Absolutely.
I'm going to take a bit of liberty as a facilitator to also pose a question, if that's all right.
Sure.
Uh, so one of the great things about um, conferences in general is bringing people together from different spaces and experiences to come up with solutions and opportunities because there's a lot of experience from you two that you've shared, but also experience within the room. And so, as you were thinking about this, kind of at there's a systems level, and Brian, you made a note of it to say there are supports that can be in place to better support people as they are getting out. Um, I'd be curious from your perspective of who do you want to partner with? Who do you think? What are some of the other agencies that are part of this system that can help further your research? Or kind of, there's different segments for different spaces. So, uh, who can help you be even more successful in what you're trying to do?
That's an interesting question, honestly. There's a lot of agencies that I feel there's pushback against CSC. So I'm not sure if I would want to like team up with CSC to try to make change, but maybe places like CMHA, family healthcare places, even the justice system in general, like make contacts with crown attorneys, things like that. I already do that, and I try to help people that way. But there's a lot of people, and I don't really know where to start. So we're just kind of letting it grow organically and hoping it works out for the best.
And so that's a note and a plug for our conference attendees, just to help build those connections. I know one of the areas that CMHA works with, um, it's called the Community Reintegration Planning Table. So there's those local tables that kind of support that reintegration process with different agencies coming together to think through some of those things of uh, housing, education, employment, to say what are the supports that are needed to get that reintegration going through successfully.
Mhm. That sounds great. We would be more than happy to advise them.
Absolutely. I'm in Northern Ontario, and I don't see a lot of that from CMHA
Mhm.
or anyone really. So it's a gap that needs to be filled,
Mhm.
and we could help with that. And that might be it for us. I don't know.
Yeah, I'll put that opportunity out there again for our delegates. If you have any questions or comments, feel free to share them verbally or through the chat. Um,
We also have our fearless leader, Lindsay Jennings here, who is, I forget the exact title, is it community investigator? If Lindsay, if you wanted to say anything or say hi. Lindsay organized us all, and we wouldn't be here without Lindsay.
Thanks, Dina, for putting me on the spot.
Sorry.
No, it's fine. Yeah, I am the community investigator of the Prison Health Research Council. And it's just been such a pleasure. And I can't, everything that Brian and Tina said, it made me a little emotional because we worked really hard. And I think that it's really nice to hear that we slowed things down and we taught people and we gave people skills, and like that people feel like it's a collaborative and it that they have agency in these spaces. And I've personally, I've been a part of HSJCC for about 10 years. And lived experience is always a tough pull within many organizations, but also networks. And so, I think for me, that's what drove all this, is that I wanted a space where it was made up of people with lived experience. I want to work with people with lived experience. And we have a great project team of Dr. Fiona Kumjin and Dr. Claire Bodkin and Jessica Gaber who empower us and really provide the space. And they've made things happen, and they support us, and they're just really driving us in a great direction. And so we're really looking forward to the next steps in of producing and co-leading research around like the harms of incarceration and how we actually need to do a lot more for people inside, but also post-release, around people's healthcare, and also just like the lasting effects of incarceration on people's healthcare. And so there's a lot to look forward to. And so we're just getting started. So thank you, Tina, and thank you, Brian.
Thank you.
Thank you, Lindsay, for that note of gratitude and looking ahead. And so I think with that, I'd like to invite all of our delegates to thank our speakers for the presentation and sharing their knowledge with us. There is the very fun little react button in the middle of your Zoom bar. So if you click the heart, then you can click
Mhm.
another button and have some fanfare, have some hearts, have some balloons. So there we go. That's the joy we're looking for.
Oh, thanks.
And so similar to the other sessions throughout that you've attended, there is a survey button. So if you go back to the conference platform, you by that join button, there'll be a survey button you can click and help us inform how our speakers did, and we'll share that feedback with them. And then also, now that we're getting to the end of our 2-day conference, there is a broader full conference evaluation button that it's an icon on the conference homepage. So again, I encourage you as delegates to click on that and give us some feedback. And as we head to the final portion of our conference, there is one note of closing remarks. So that'll be the final part on your agenda. And so to participate in that closing remarks, as you've done before, you can click that join button, and you will be in the room and ready to go. So with all of that, thank you again for your participation. Thank you for sharing, and I hope you have a lovely day.